Certainly, as we know, the head weighs approximately 12 pounds, which is very similar to the weight of a bowling ball. Our head is attached to the cervical spine to these little tiny bones at the very top of our neck. What happens to the bowling ball or the skull during a whiplash is when we're hit from the rear, the shoulders are pushed forward. The head, according to physics, does not move. And it actually forms an S-shaped curve, and then it slingshots backwards and then back forward. And this is what causes the tearing of these ligamentous structures. It happens instantaneously in less than a second's time, and that's why a lot of times following the whiplash, we have headaches and posterior neck pain. Let me grab a set of big bones just so I could demonstrate the anatomy a little bit clearer. Most people don't realize that the discs, which are these shock absorbers between the bones, are only located in the lower 70% of the cervical spine. The upper 30% of our cervical spine contain no discs. Actually, this upper 30% is only held together by ligamentous structures. These are the little ligaments that attach bone to bone. Also, when I flip the big bones over, there are no discs in the back of the neck. There's these joints that allow us to turn and twist our neck. These are only held together by ligaments. What happens during a rear impact collision is these ligaments that were once holding our bones nice and tight together are stretched and elongated and torn. And it causes the joints to now move abnormally. And a lot of times we hear this crunching noises as we move our neck. Also, certain movements will increase the pain in our neck. Those are signs and symptoms that you may have a ligamentous injury. Now, here was my worst patient. Worst patient, his neck was broken and missed on x-rays. His head is not attached. It's only spinal cord holding his head on. I didn't notice that. I mean, as Anthony brought his head, I looked up. He dropped to the ground, and I called 911. And I thought the guy was going to die. Here's another one. He was okay. They wired him together. Here's another one here. Boom. Now, I see these all the time. And if you've seen what I've seen, you want to touch anybody until you've done one of these. It's just amazing. Shoulders are incredible. Jose, let me freeze this. Jose went to the orthopedic surgeon. Guess how many MRIs? It's the golden standard, 5. They said, Jose, stand still, don't move, and they took an MRI, 5 negative MRIs. The treating doctor took 30 non-moving x-rays, all normal. So I go to Jose, I go, I'm no rocket scientist again, but how does it hurt? Because I keep telling all you doctors, when I lift my arm above my head, my shoulder pops out of place. So I said, well, I'll tell you what, I'm the guys listening to you. Lift your arm above your head, watch it pull out of place. There it goes. So I went to the orthopedic surgeon, I go, there's your problem, you never asked him to move. See, technology has advanced so much that this makes treating patients easy because we can see. And again, for you attorneys out there, watch his face. After it pops out of place, boom, look at him grimace with pain. He's like, oh, you can't fake that. It's there. They don't take that into court. They settle it before.